Hello, I'm Dr. Collins, and in this clinical examination video, we are going to explore the FABER test, which is a key special test used to assess the pathology in the hip joint and the sacroiliac joint. Before we demonstrate the FABER test, which is also known as the Patrick's test, let's briefly recap the anatomy involved so that we can really understand what this test is assessing. The hip is a ball and socket joint formed by the femoral head and the acetabulum. It allows a wide range of movement, including flexion, abduction, and external rotation. Posteriorly, we also have the sacroiliac joints, which connect the spine to the pelvis and plays a crucial role in load transfer. The FABER test puts both of these joints under stress, creating a mechanical stress pathway. Depending on where the patient feels the pain upon eliciting the maneuver, we will be able to distinguish if the culprit is the hip joint or the sacroiliac joint. If the pain as a result of the test is felt in the groin region, we will think of a hip pathology. If the pain is felt in the posterior pelvis, then we will think of a sacroiliac pathology. So essentially, the location of the pain will tell us where the problem is. Before we demonstrate the test, a quick note on its clinical value. FABER test is considered highly sensitive, with values ranging from around 71 all the way up to 96%, but it has low to moderate specificity, typically between 25 to 56%. In practical terms, what this means is that it is a good initial screening tool for detecting when something is wrong. However, it is not specific enough to pinpoint the exact cause of the pain, and it is also prone to false positives. To perform the FABER test, ask the patient to lie supine. We will demonstrate the test on one side, but always remember to examine both sides and start with the unaffected or less affected side. Broadly, what we will do is to take the leg being tested and place it in a figure 4 position, which, by the way, is also another name for this test. But the FABER name itself is also very helpful in aiding you to remember the maneuvers that you will need to do. F for flexion of the hip, A for abduction of the hip, and finally ER for external rotation of the hip. That's where the name FABER comes from. So flex the patient's hips, abduct it, and externally rotate it, and let the foot gently lie on the patient's contralateral knee or just below the knee if this feels too difficult or uncomfortable. Once the patient assumes the FABER or the figure 4 position, what you will do is place one hand on the opposite side on the ACEs to stabilize the pelvis. With your other hand, gently but firmly apply downward pressure on the flexed knee on the examined side. Normal, in other words, negative FABER test result, is if the knee drops comfortably towards the couch and is in line with the other knee with no pain. FABER test is positive if the patient experiences pain when the knee is pushed down or if the patient can't fully drop the examined side level with the other knee. At this point, ask the patient, where do you feel the pain? Remember, if the patient experiences the pain in the groin region as you press down the knee, this suggests a hip joint pathology, for example, osteoarthritis or labral pathology. However, if the patient feels the pain posteriorly in the buttocks or the SI joint regions, this suggests sacroiliac joint pathology. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical examination videos in our channel. Good luck!